Thank you so much. Now we have really the final chapter of of this conference. May I? No. There, stay there, because it was just to thank you, Sandra, thank you, Emma, from us, from I think all the participants to the conference, particularly from Altems, for this opportunity to host this conference. I would like also to thank all the staff here. I have already at the beginning made a vote of thanks to the people that was managing, the organization of the program and so on. I would like to also make a vote of thanks to the event department of the university that has organized also physically this conference, and again to all of you. Many thanks.
Thank you.
Thank you.
So, dear colleagues, it's a real pleasure to be standing here a year into my presidency, and I feel energized. I have a little secret to say that I've been mentored by Professor West. So, dear George, some of the skills I've shown over this year, and dear colleagues, have been very much influenced by my training with Professor West. Thank you. Okay, so dear colleagues, we have arrived to the end of the EHMA 2023 annual conference. And before sharing some closing reflections with you, we'd like to celebrate the research that has been presented at this year's conference with our award ceremony. It is indeed my pleasure to introduce Dr. Pamela Mazzaccato, second take, Mazzaccato. Well, that's difficult even for me. Co-director of the Medical Management Center at Karolinska Institutet, that will present the Karolinska Institutet Medical Management Center and EHMA Research Award. Apologies for...
Thank you. Being an expat since 17 years back, I'm quite used to my surname being pronounced in different ways, so you did great. Thank you so much. I'm the co-director of the Medical Management Center at the Karolinska Institutet, and I'm very happy to share the results of the competition that we have for PhD students within the context of EHMA. This prize was established by Professor Mats Brommels. I'm sure some of you are familiar with him. We're all standing on the shoulders of giants, so I think it's important to mention them. So this prize aims to acknowledge the scientific contributions of work done within the context of a doctoral thesis. And it also aims to provide a small financial contribution for PhD students towards the end of their doctoral studies. And we had a large number of applicants this year, and we selected 5 candidates to present their research yesterday. And I would like to mention all of them by name. So the 5 candidates were Sara van Tuing, Boudica Samarasainge, Rosella Pellegrino, Peter Perger, and Sara Ingvarsson. Of those, thank you. We were really impressed by all the presentations and the work, and we assessed them based on, of course, the scientific rigor and also the relevance for healthcare. Together with me in the jury, we had Professor Axel Kane, Professor Ronald Battenburg, and Professor Americo Cicchetti. And as I said, we definitely assessed their scientific rigor and the relevance of the topic. What stood out with the ones we selected, so I anticipate there are 2 winners, is that beyond the relevance and the rigor, they were also able to ask courageous questions in the research and to question the status quo of how we do things today. And I think this is something also I would like all doctoral students in this room to continue think of, being humble, but also being courageous to question the status quo, because that's the only way we can improve things. And with this motivation, the 2 winners, and I anticipate that with the contribution of EHMA, we were able to double the prize, so both winners get 1,000 euros as the prize. And the winners are Dr. Sara van Durin and Boudica Saramansinghe. Please. Yes, and now we would like to invite you to present your research. I think first is Sarah. Do we have Sarah in the room? Yes, welcome. Thank you so much.
Okay. I'm just trying to find how it works. Perfect. So hi, my name is Sarah van Duin, and I would like to tell you a little bit about my dissertation titled Tinkering with Tensions, Boundary Work and Collaborative Governance. It's over 250 pages, and I have 5 minutes, so let's go. Over the last decades, reforms furthering localized and integrated care have become increasingly popular across Europe. They're supposed to create more efficiency, tailor-made care, and just a better system overall. This promise sounds intriguing, but it is easier said than done. In fact, literature and practice both show that organizing local integration is prone to non-productive conflict, change inertia, and is just notoriously hard to achieve in the first place. This is because such reforms imply both a redefinition of horizontal boundaries between partners in the system, as vertical boundaries between central level actors and local level actors. In my dissertation, I studied the Dutch long-term care reform and used different methods which allowed me to both zoom in on these horizontal boundaries and zoom out to the vertical boundaries that actors redefine when implementing healthcare reforms. And I asked the question, how do local actors and national actors engage in boundary work while reforming the Dutch long-term care system? I used the boundary work perspective to analyze my data and found 3 tensions actors tinker with when governing healthcare reforms. So I want to briefly go over the content, the main questions that emerged, and the findings for each of them. First, a tension between epic tales and tragic tales. Change advocates, in this case the central government, often devise an epic tale about the change. In this case, the narrative of the central government stressed how the reform would save the Dutch healthcare system. It would keep care sustainable, affordable, accessible, and even improve its quality. However, immediately there is a counter-narrative, the tragic one, which points to the unruly reality in which change has to be implemented. In this case, the media sketched a picture of an irresponsible reform, which no one was ready for and would leave citizens to suffer. Now, these tragic tales seem disruptive, right? Like kind of a problem? Well, my research shows that these tragic tales are actually very important, as they can help policymakers think through the practical consequences of reforms. As such, they need to be heeded and used. Second, a tension between integration and differentiation. Key to organizing healthcare integration is bringing together different ideas and perspectives. As such, we need both integration and differentiation, and we tend to ask, how do we get past the messy conflicts, establish integration, and stay there? My research, however, shows that conflict is key in working towards successful collaboration. It needs to be fostered as it helps get the different perspectives of collaborating actors into view, who can consequently come to more meaningful conversations and see where their perspectives do or do not align. So we need both. We need both integration and differentiation when we work towards collaboration. Then third, attention between decentralization and centralization. When organizing local integration often goes hand in hand with decentralization, and local actors become key stakeholders in governing healthcare. However, if it doesn't work out locally, the central government tends to take back control again and move back to centralization. And often with the same arguments as why decentralization was pursued in the first place. And my research shows it might be much more helpful to keep the tension intact and, for instance, have central governments take on a more coaching and facilitating role, while local actors can give the central government feedback on how these central policy ideas align to the practical situations. Then, in sum, what does my research teach us for future healthcare reforms? First, inherent to reforms are constant tensions on horizontal and vertical boundaries, as pictured there. And my work shows 3 ways we can tinker with them. First, align. Tragic tales that may seem disruptive can actually help sharpen the ideas and implementation of an epic narrative. Second, understand. When bringing together different perspectives, conflict can become a tool in working towards mutual understanding. And third, configure. Outline a playing field, but leave room for local variety and feedback. In short, instead of attempting to resolve tensions, I would argue for tinkering with them. Tensions are important. They keep the system dynamic and adaptive. We need a dynamic tinkering approach in order to reform boundaries in a sustainable way, as well as to organize collaboration across professions, organizations, and sectors. And my work shows that people have the best tinkering skills. So let's tinker. Thank you.
So we need a photo first. Those are the instructions I have.
Good afternoon, everyone. My name is Prof Sandra Buttigieg. I'm from Birmingham University. During my doctoral work, I developed several transferable theories, and I'm sharing one of them with you today. Undesired outcomes is a significant problem in any health system. It's a headache. It provides a lot of suffering. But it is very little we know about how standardization, individualization, the interplay, how that impact on undesired outcome, i.e. quality. To investigate that, I done a comprehensive investigation on the day surgery cancellation, which is one of the very common long-standing problems. I think in a healthcare conference, I don't need to tell about detail about on-the-day surgery cancellations, but when a patient come on the day to admission with a lot of expectations to undergo a very vital surgery, we have to turn them away. That is a very great tragedy as well as a great expense. So in my work, I deep dive into this undesired outcome. To go to the ontology, our health systems has a very complex system, layers of context. To understand the deep onto ontology, I use multiple methods to using realist methodology and develop numerous amount of context mechanism outcome configurations, which are causal mechanisms. Now in my next slide, instead of giving lots of results, I'm going to share with you a small fictional story. Bear with me. This is coming from England. Somebody called Robin Hood. Robin Hood is outlaw, and for some, it is a legend. And he had number of wounds. He sleep rough. He had a lot of respiratory issues, cardiac issues. He's been running around from the government or the establishment for a while. Robin Hood came to a pre-operative assessment to undergo surgery in NHS. The pre-operative nurse had a real problem. The clinical protocol given really does not fit into Robin Hood's profile. Sadly, the managers in the NHS told nurse, you only get 10-15 minutes maximum assessment time because we got lots of waiting list and lots of targets to achieve. On top of that, as some of the distinguished gathering mentioned, the nurse was under huge pressure of workload, stress. She wanted to do a real good job, but she couldn't. She was unable to do it because the organizational context didn't provide that. On the day of the surgery, a thoughtful, very meteorological and anesthetic consultant came to assess the clinical suitability of Robin Hood. He said, you are a legend. I really like you. But I have to cancel your surgery because I don't think you will fit for, if I give you general anesthetics, you are very unlikely to come out as a patient, so I'm worried. Sorry, I have to cancel you. The legend, the urban legend, going on for a number of centuries, also become a victim of surgery cancellation, a modern phenomenon. So it's a simple example, but that example shows you something profound to me, which is we are being standardizing our health systems. And it is questioning a standardization sometimes feel like questioning the divine. But it tells you how this conflicts with our individualized patient needs. So I developed number of context mechanism outcomes from multiple evidence. This is one of them. So I really choose this one immediately when I saw Professor Michael West is coming. So it just tells you how inadequate level of clinical autonomy due to lack of time inactivate the compassion mechanism and led to lack of individualization care, create a ripple effect, and which create another context, causal chain, which again create a lack of trust in the anesthetist, and which led to legends like people like you being cancel your surgery, denied your surgery. Okay, so this is the research question I've been asking for 5 years. It's a painful question, and it's a burden. And this is not the answer, a answer. So I argue in my work using multiple evidence, adequate level of clinical autonomy in our systems is very important to bring the gap to merge the standardization and individualization of care. And of course, you can see it will provide a more individualized care and create trust among other actors and reduce undesired outcomes. So this is the kind of a wordy definition, because when we are in a complexity, it's always important to tell the qualitative story as well. So I think to this gathering, and it's where we talk a lot about compassion, and I am one of the contribution I'm making is I am contributing how compassion of the nurse effectively can minimize one of the biggest undesired outcomes in our health systems. And I make that link. And obviously, I call this a transferable theory where you can use any health system despite whatever the level of standardization is. So takeaway messages, there's 3 takeaway messages from me for you. If you are a healthcare professionals, there's a lot of talk about standardization. And we went to 10 years, 8 years to whatever the medical school we went to or nursing school. Please take your standardization as well as a clinical autonomy into your hand. It's okay. And if you are a manager, I urge you to ask some of the questions like the panel asked. Ask the question, have I given enough clinical autonomy to my clinical teams? Am I creating that favorable organizational context? Then you become maybe a compassionate leader. And finally, people like yourself, very powerful, knowledge brokers, academic, policymakers. We sometimes talk so much about targets. We so much talk about, standardization, interventions, outcomes. But remember, in my evidence, and lots of other people's evidence also, clinical autonomy. We need to add standardization and clinical autonomy together in our dialogue. Then it is okay for a nurse working in a very different hierarchy to talk about their autonomy. Thank you very much for your attention.
Wow, that was powerful, both of them. So I agree with you, Pamela, for the way you've actually introduced them. I'm now pleased to announce the EHMA Awards. Every year, the EHMA conference brings together top quality research from Europe and beyond. We take pride in providing a platform to share health management knowledge, research, and inform evidence-based policies. Without, taking long to do with it, to announce this, I would like to call Dr. Padriak Fleming, winning the EHMA Award for Best European Paper. With his paper, A Realist Review of the International Literature demonstrating how governance and decision-making during 2008 financial crisis impacted health workforce resilience for COVID-19 and future health systems shocks. The EHMA Award for Best Non-European Paper goes to my dear colleague, Dr. Gilly Gabay. With the paper, Personalized Digitally Driven Communication with Patients at the Emergency Department. We need to take a photo.
Thank you. I'm honored. Thanks for the acknowledgement.
Okay. The EHMA Award for Best Poster goes to Dr. Olena Chernenko. Healthcare in Ukraine during the war, challenges, lessons, and conclusions for rethinking of medical systems. The People's Choice Award for Best Poster goes to Cattolica del Sacro Cuore with the poster A Systematic Review of Evidence on the Gap in Leadership Studies in Healthcare. And now the announcement you have all been waiting for, which is where we will meet next year. There's so much energy, we need to keep on going, We will not disappear. Fine, so I am extremely proud to announce that next year's EHMA 2024 will be in Bucharest, Romania. And I am very proud for EHMA to have, of course, the great local co-host from Romania, Professor Cristian Vladescu, General Manager at the National Institute of Health Services Management and professor at the Faculty of Medicine at University, T2, I don't know whether I will do that, but Miarescu in Bucharest, Romania. Please.
Thank you very much. Listening to your presentation, I will try to be compassionate in my speech, so I will be very, very short. On behalf of the Minister of Health of Romania, I am proud and happy to announce you the decision and to thank you for the decision to co-host the next EHMA conference in Bucharest in 2024. Behind me, you see some pictures from places from Bucharest. If will be more time than here, you will be more than welcome to visit them. And I also want to take the opportunity to thank not only to the EHMA organizers, but also to the Italian co-host and to say grazie to them. And to hope to see you next year in Bucharest. I don't know if I have the last picture I wanted to, this one. So if you didn't have time to see the Lupa Capitolina from Rome, we have the exact replica given to Bucharest by the city of Rome. So if you didn't succeed now, next time probably we'll meet those two in Bucharest. Thank you and see you in Bucharest.
Thank you so much. Thank you so much. So we are literally now at the end of these 3 intense days that were inspiring, challenging, full of meetings, full of opportunities to exchange, network, joke, laugh, and enjoy ourselves. Indeed, I must say that I have felt a great and positive energy. But not just today. It's been growing over this year. And Professor West at EHMA, we are indeed a team, a well-functioning team. There is energy, there is engagement, and I believe also compassion. There were times when there was a great deal of work overload. And I think George has to take some lessons there. To make sure that work is also distributed, because George is, wants to work a lot, as you could see. Nothing comes without hard work. So there's a lot of hard work in order to be able to be professional, to be noticed, and to have, the best in whatever we have presented, delivered, organized. In concluding this wonderful conference, I would like to thank the many partners that made this conference possible. A big thank you to Philips, MSD Europe, European Observatory on Health Systems and Policies, AstraZeneca, Sanofi, ENI, Moderna, Altum's Advisory, the Univant's Award for Healthcare Excellence, AbbVie, Coloplast, Leo Pharma, Edwards Life Sciences, Bristol Myers Squibb, CFE, and Be Kind. Also, another big thanks to the JADECAR, the Aquip Plus, and the Be Well projects. Well, we are truly nearing the end, and of course, I would very, very, very much like to thank the hosts and all the people involved in this conference. Starting with I have on my list, according to the protocol, but Americo Cicchetti, you've been absolutely fantastic. And using George's way of describing people, you have been phenomenal. Okay. Well, I would like to thank the Minister of Health of Italy, Professor Orazio Schillaci, who graciously introduced this conference 3 days ago, the Dean of the Faculty of Medicine and Surgery of Università Cattolica del Sacro Cuore, Professor Gasbarini, and the President of the Faculty of Economics of Università Cattolica del Sacro Cuore, Professor Occhino. And our wonderful co-host for this year, our member Altems, Università Cattolica del Sacro Cuore. A special thanks again to Professor Americo Cicchetti, Director of Altems, and to Dr. Yep, please. Oh no, dai. And Dottoressa Federica Morandi, Director of Academic Programs at Altems. And of course, to all the Altems staff and PhD students that supported the organization of this conference. Your generosity, kindness, and support have been unparalleled and indeed inspiring. Well, of course, this conference, EHMA, cannot exist without, people. We've been talking about people. And this year has been full of activities for the EHMA board that I'm president of. And I would very much like to thank my colleagues. We have been a team, and we have been a team where, we had one common goal. We had a common goal that aligned with our goals, so we could reach the team task of having EHMA becoming more visible, more relevant, and more efficient, effective, and performing. Indeed, I want to thank Vice President, Professor Axel Keen, Dr. Alexander Lorenzo, Dr. Teppo Heikila, Professor Todorka Kostadinova, Dr. Esther Kovacs, Professor Federico Lega, and last but not least, Professor Anne Mahon. Thank you so much. Thank you so much. It's been great talking to you formally, informally. And finally, what we refer to as the back room. Thanks to training received as well from Professor Gammel, who's here, I think. Backroom work, yeah. Nothing comes without the backroom work. The EHMA Secretariat, and I would like to call them up here near me. My great teammate, George Valiotis, you've been great, you've been inspiring, and you've changed EHMA into a highly relevant organization after a time that was very difficult for us. Annette Ruzanov. Okay. Federica Margheri. Well, Federica, I was instructed to call your name 10 times because the work you've put in, not just for the conference, but over the years, you've been absolutely exceptional. Okay, Laura Kande is in Canada, I think. Well, you see, you have many people working outside as well. Joey Milona. Zachary Dasson. Zachary, where are you? Thank you. Olga Poliava. Olga, thank you. Evelyn, our dear Evelyn Donahoe. Thank you. Claudia Granaldi. Amy Veller. Domenico Sorrentino. Dina Levinson. Giorgia Cariami. Marina Puerta Garzia. And last but not least, the person who takes care of our accounts, right? Yeah. Ludmila Kmielewski. A big applause to these people, you know, they're our heroes. Thank you so much, thank you, thank you. And this is really, really the very end. I would also like to thank each and every one of you for being here and having contributed with your research, insights, experience, and knowledge. And I cannot leave Rome without a sentence in Italian, right? Grazie di cuore a tutti voi. Non vedo l'ora di vederci il prossimo anno in Bucarest, Romania. Grazie a tutti e grazie Roma. Thank you.